Hello, ladies and gentlemen. My name is Dr. Kalitenko, and I'm a medical doctor. I'm board certified in internal medicine. And today we are going to talk about intravenous therapy, IV therapy, IV nutrition, IV vitamins, call whatever you like it. But the idea is to deliver nutrients and vitamins without using digestive tract system. Why is that important? And why did I come up with that idea? Actually, I was not obviously the first one who used that, but I realized only recently the importance of IV therapy. And why? Because if you put something in your mouth, it doesn't mean that this thing is going to be digested and absorbed. Why? Because not all the time there is no guarantee that your digestive system is working properly. And as soon as I started testing digestive system, I found out that many people they have significant problems with their digestive system, like lack of hydrochloric acid, lack of digestive enzymes, bacterial overgrowth, parasites, yeast, etc., etc. And this is a huge problem because, for example, lack of digestive enzymes prevents you to absorb a lot of nutrients and including fats, and as you know, in order to absorb fat soluble vitamins like vitamin A, vitamin D, you need to be able to absorb fats, and if you can't, then you have a problem with absorbing vitamins and other important things like omega-3 fatty acids, etc., etc. Bacterial overgrowth is extremely important for vitamins because bacterial overgrowth was linked to the problems with vitamin B complex. And as you know, that vitamin B complex is necessary for almost everything, heart, brain, etc., etc. You can't function without it. And obviously there is a problem with other nutrients like iron, magnesium, etc., etc. Obviously that if you are lacking hydrochloric acid, you cannot absorb metals. There is a huge problem with metals, and especially if you're taking some kind of medication that decreases your hydrochloric acid production, like Nexium, Prevacid, etc., etc. And that's why many people who come to see me, they have that problem. And to fix it, the easiest and the fastest way to help those people is to give them intravenous nutrition and vitamins. So what do? Our main thing that we give is Myers cocktail. What Myers cocktail is? It's the B complex, vitamin C, magnesium, sometimes we add calcium, and this most of the time it works very well and we get the results we want. People start feeling different, start feeling better after intravenous therapy. Of course, if they are lacking those substances like vitamin B complex or vitamin C or magnesium, we don't give those nutrients unless we think that it might be beneficial for the patient. Obviously, it's not the only IV therapy we give. Another type of therapy we're giving is intravenous vitamin C megadoses. We give 25 grams, we give 75 grams a session, and it's quite a high dose. The reason for that is because for some conditions, including cancer, we try to give this type of therapy if a patient wants it, of course, and there is no other way you can get 75 grams of vitamin C if you're taking it in pills. You're going to develop the gastritis or whatever. The problem is probably that's you're just not possible to swallow so many pills, and if you can, still you will have an irritation of digestive tract because vitamin C is an acid. So if you take too much acid, obviously it's going to damage your digestive tract. And I had a few patients who tried to do that, they failed because of the gastrointestinal complications. And that's why we need to give that type of therapy for the patients. And obviously patients who are lacking magnesium, they also benefit from intravenous magnesium therapy. We usually give them in conjunction with vitamins, but the main thing is to give magnesium as much as possible. Why is it important? The problem with magnesium is that if somebody is lacking magnesium, his heart is at risk, because as soon as magnesium goes down, heart becomes unstable. And keep it in mind that about 50% of patients who died because of sudden cardiac death, they were found to have low magnesium. And that makes sense, because as soon as somebody doesn't have enough magnesium, his heart becomes unstable, can develop lethal arrhythmia or stop at any time. That's something that's very simple and that's very logical. So why, once again, why do we give intravenous therapy? To bypass digestive tract, to maintain the proper, to get the proper dosage, as is in case with vitamin C, we need very high dose, or to make sure that these nutrients we want are delivered to your body. Because if you have problems with the digestive system, no way you can absorb your nutrients. That's why we are using intravenous IV therapy, vitamins and nutrient therapy to help patients out in this kind of situations. Thank you.